Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow. Thank you for joining us here on the NPTE Final Frontier podcast. My name is David.
And my name is Emily. Today, we will be interviewing Dr. Alex Hill. Dr. Alex Hill earned her Doctor of Physical Therapy degree at the University of Florida, Jacksonville, while completing her Women's Health Physical Therapy residency at Duke University. Now, she specializes in pelvic health, oncology, and lymphedema-related conditions. She is also a dual board-certified clinical specialist in oncological PT and women's health PT. She is a LANA certified lymphedema therapist. Now, she offers consulting and coaching for PTs and companies seeking expert opinions too, which is such an awesome addition to her resume. Now, in addition to all of these things, she also even offers continuing education courses and resources for rehab professionals. You can find all of this information more on her website, oncopelvicpt.com. So that's ONCOPELVICPT.com, where she also has multiple blogs. Now, Dr. Hill, thank you so much for joining us today on the podcast.
Thank you so much. As you say all those things, now I realize why I need more naps during the day as I get older. Staying busy.
Don't we all? But thank you for joining us, and let's hit one of the big questions. What got you into physical therapies? What got your interest with the entire field? How did you get in?
Yeah, so I actually started out in college as a pre-med major in chemistry, and ended up shadowing more with physicians and realizing like, they really don't spend a whole lot of time with their patients. It's very algorithm based. There's not a lot of, from what I saw, like a lot of outside the box thinking. Like you had some repertoire with your patients, but it wasn't really building relationships. And so I had actually had physical therapy when I was in college for my hip. I had hip surgery and had a really great experience with it. And I knew I wanted to do something in healthcare. And it's like, well, why don't I just shadow with some physical therapists and learn more about it? And so I love that you're active, you're building relationships with patients, you're seeing people frequently, you're able to really see great outcomes and improvements and people feeling more empowered and confident within a visit or a couple of visits. So I absolutely love that. So that's what made me actually switch my junior year of college. I ended up staying an extra semester so I could get those prereqs done, but I just felt so strongly about getting into physical therapy that it was worth it.
That's
so
awesome.
Now to go one step further from that, because you mentioned you kind of got into it from more of an ortho perspective as the patient needing the hip. What really decided your career path to pursue not only pelvic health, cancer rehab, but also lymphedema, kind of all three in one?
Yeah, so I hadn't really known about these particular specialties when I started PT school. Unfortunately, this hasn't changed much over the last 10 years since I've been a clinician, but a lot of PT schools don't even really have a lot of curriculum in these areas. We had like a couple-hour lecture on each of them kind of thing. But at my first clinical rotation, which was an outpatient orthopedic clinic, we had several pelvic health and oncology PTs. They practice both of those. And I just wanted to know, like, what do they do behind the doors all day? And so my CI let me shadow them, and I fell in love with it. I thought that it was amazing, the impact that you could have with somebody who is dealing with something as sensitive, sometimes traumatic, sometimes life-changing as these pelvic health conditions or dealing with cancer, and really just like sitting and talking with them and validating how they feel. And for a lot of people, especially in pelvic health, when I was shadowing, I mean, they had been dealing with leakage or pelvic pain or other things for years or decades and told like, oh, it's normal part of aging. Oh, normal after cancer, normal after you have a baby. And that that narrative didn't sit well with me. And so being able to, do these assessments and tell them like that, actually, this is your pelvic floor and we can do something about it, I thought was just incredible. So I knew that I wanted to get into these specialty areas. My clinical rotation, I wanted it to be like a comprehensive kind of pelvic health rotation, but it ended up being more orthopedic and OB. And so that's what actually led me to doing the residency. Was I knew that I wanted these complex cases. I wanted pelvic health and oncology. And so that's what took me from UF in Gainesville to Duke University.
So
That's
you
that's
didn't
fantastic.
really So you
Yeah.
didn't really start with one area and then expand to the others. You kind of knew you wanted to incorporate all of these avenues to really treat these patients as a whole. Because, like you said,
Yep.
many of these patients related to these three specializations really do often have all of these working systems that need addressing through physical therapy.
Yep, absolutely. Absolutely. It's been really interesting, especially again, I've been practicing 10 years to see a lot more overlap between the specialties. So now I like my caseload, I work with strictly pelvic health patients. I work with all genders, including we do gender affirming care. I work with strictly kind of oncology patients. So that could be head and neck cancer, that could be breast cancer, any type of pelvic cancer. And then I have these kind of mixed patients who have oncology and pelvic health concerns. Or I might see them for one thing and we're talking, and then we end up getting another referral for seeing something else. So it's been a really interesting and cool journey to see it improve over the years.
That's awesome with the entire journey, especially how the reasoning with getting one of the reasonings is because of that one-on-one time with the patients that you noticed that other professionals weren't able or weren't given to patients. And currently, with everything that's taking place, I mean, a big hot topic is medical gaslighting,
Mm-hmm.
where the doctors, the MDs, and everybody's just not listening to the patients, and it just so
Yep.
happens that it happens more so in the female population, where
Mm-hmm.
they just won't be heard. So for you to be able to take that time to speak to them, get to know them, and really consult them on everything that they're going through, and to let them know that what they are feeling is actually either normal or it's something to be of a concern and that everybody else is really taking it lightly. So I think that's really incredible with what you're doing.
Yeah. Thank you. Yeah, it really is. And it's also it's really frustrating as well to hear how many people are coming in and they are gaslit and, oh, actually this is stage 3 cervical cancer. It's not just fibroids or something, and they weren't being taken seriously. So unfortunately, still is happening, but I feel like it's becoming people are getting better at advocating for themselves. And as physical therapists, I think that we have a really important role in being able to do that because we do have that extra time to educate people and explain things to them and kind of sometimes end up being almost like a primary care provider, kind of a quarterback to help make sure that they're getting to the right people and the care that they need.
Yeah, and you definitely serve as a great resource to be able to make sure that they're getting that proper treatment.
Yep.
Um, so that being said, with what we just spoke about, what is one thing that you feel could be done to make physical therapy, the profession, a bit better?
This could I was thinking about this question earlier. This could be answered so many ways. I mean, this could be a whole day conversation.
Oh
And you
yeah.
could really answer it from a couple different perspectives. Like you could answer it for the profession as a whole. I think we need honestly more members who are more physical therapists, PTAs, and students who are members of APTA, because that them PT Pack, like we need people lobbying for our profession. We need people who are active and advocating for our profession and for the care that we provide and for supporting our patients. From a student perspective, the cost is, as I'm sure other people have said on here, astronomical at times. So I think just the cost of it and having more resources available is something that could be improved. One thing, luckily, so I do the PSLF program, the Public Service Loan Forgiveness. So that's amazing that physical therapists are included with that. And then from a patient perspective, I think it's access to care and access to PTs who are specialized. So you think, especially with our rural populations, like they really don't have a lot of access to pelvic PTs or oncology PTs. I have people coming in, driving in from an hour away because there's no one else near them, or we're doing telehealth appointments. So, we've made a lot of strides as a profession over the years, but there's still a lot more that can be done in a lot of different ways. But I think I'll keep it right there for now.
No, you hit everything from each perspective, and one of the big things that you mentioned was definitely is that APTA membership. We have such a large field. We have so many people involved, so many voices, and the best way to have your voice be heard is to go get involved. Go have your membership, but not just have a membership, do something with that membership. Make sure that
Yep.
you're active in there. Don't just sit on the sidelines and say that we should be fighting for reimbursement rates, but you're not involved with that fight for
Right.
reimbursement rates.
Exactly.
Yeah.
Exactly.
And David, just to even take that point one step further, I think that shows how Dr. Hill is doing exactly that, right? You just talked about how much our profession needs more education. We need more specialties. We need to be fighting more for our field. And you're doing that with your website. You're providing continuing education courses options. You're providing blog posts to help with engagement, to help students or physical therapists who aren't really sure which path they want to go on. So you're doing exactly that within oncopelvicpt.com. So thank you for not only giving us those pieces of advice and how our profession can do better, but also being a part of that to help make the profession better. Because that's exactly like David said, we can't be sitting on the sidelines. We need to be actively participating and trying to change the field, which is what you're doing with your website. So thank you for that.
Thank you. That means a lot. And it's always a team effort. It takes a village. I've been really, really lucky with having some amazing mentors over the years. Some from UF that I still work with now. We're working on a clinical practice guideline. So it's, you know, making sure that you're surrounding yourself with the people that you're aspiring to be or the type of person that you're wanting to be. So it's
Mhm.
appreciated, but it is also,
Yes.
it takes a village for sure.
So to kind of go off that a little bit more, as a clinician, initially, what was really one of the biggest difficulties you faced when starting your own business, when trying to get into this avenue more?
Um, for me, I've never been one to want to be an entrepreneur. In PT school, like I would have, classmates who are like, "Oh, I can't wait to graduate and like start my own practice." I'm like, "Nope, like I want to work for a hospital system. Like I want to go in, I want to do awesome work. I want to do some research, maybe write some article. Like that's all I wanted to do." But 2020 really changed all that where we had layoffs, like we had, you know, instability with what we were able to maybe do as healthcare workers, which was just unprecedented. Um, and so for me, that's really what helped me take that first step. But for me, it was just the hardest thing was taking that first step. And also feeling kind of worthy of doing this work. And saying like this isn't just it. So actually started out as an Instagram page in 2020, and recognizing that more and more people needed this content, both on the kind of patient facing side and clinicians and students interested in getting in this. Also telling myself like this is more than just a hobby. This is more than just you posting on social media. Like you have to make this bigger than you are. So for me, that was the hardest thing was just starting and kind of turning it from a hobby to a business while still working full time. So I'm still a full time clinician as well. And this is kind of a side business that I'm building up. So that in and of itself is a whole other juggling act.
That's definitely a lot.
Yeah.
So obviously with NPTE Final Frontier, we're talking to a lot of students out there. What is one piece of advice that you would give to physical therapy students out there?
Again, this is hard. There's so many good pieces of advice. I think for me, like what really helped me figure out what I wanted to do, what that path might look like, getting involved, was having the right mentors. And so for me, it was staying connected to the people that I had worked with and met at UF. It was staying connected to my mentors in my residency program. And again, those mentors are people who not just guide you and kind of handhold you, but like those who challenge you. Like, why do you want to do this opportunity? What are your next 5 year goals and how do you get there? Um, helping to connect you with other people when you go to conferences, introducing you to other people. So I think like having a good set of mentors to start out with is probably one of the biggest things that I would recommend.
Awesome. There's no disagreement there.
Yeah, totally. All right.
And it's
Well,
okay to fail. That's my second piece. I'm sorry, I have to add in the second
no, go
piece
ahead.
because I am a perfectionist. I have a fear of failure. That is where a lot of my anxiety and imposter syndrome and that kind of stuff comes in. But when I was in PT school, I actually failed a practical and I felt like my world was ending. Right. Like, but you just got to learn from it and move on. So if you fail, it's okay. You just have to keep pushing forward, learn from your mistakes.
That
Love
is
it.
something we cannot stress enough. So thank you for also saying that so they know it's not just us.
Yes.
All right, so I have the honors of asking the final question of the podcast today. And this is our fun question. This is our surprise question. Let's turn off our PT related hats and have some fun. So, as a Florida-based, PT-based question, let's talk Disney. So you just got a pint of your favorite ice cream and you are about to have a movie night. What Disney movie are you putting on?
I'm going to say Elemental because I just watched it last night with my husband.
Okay. That was a
And that
quick
is
response.
such a good movie. I cry every time I watch it.
I haven't watched that one in forever.
I haven't
It's
seen it.
so good.
I have
I
it. I do
love
have it
that movie.
DVR'd.
Yes, you need to watch it. Take this as your sign to watch it.
I
I
have
And a
to.
haven't
I mean,
close
watched
I
that in like a
second,
year.
yeah.
I think a close second right now would be like Encanto, Tangled. I watched Tangled one time when I was sick. I watched it like 4 times in a day. Those are probably my
Encanto's soundtrack. Encanto is a
right.
good soundtrack.
It really is. Of course, because
Agreed.
Lin-Manuel Miranda's on it, right?
Yep.
You can't go wrong with it.
I think
Exactly.
I'm gonna have to go back to like traditional Disney days since you just brought a bunch of like newer Disney movies.
Yeah.
I'm gonna go with my favorite movie as a kid. I was obsessed with Pocahontas.
Yes.
I was a Pocahontas girl. So I wanna go back to childhood. I'm watching Pocahontas. What are you watching, David?
Ooh, so if I'm getting my pint of ice cream and I'm getting cozy, I think I'm gonna be tossing on probably Aladdin or Beauty and the Beast.
Ooh, those
I
Beauty
are
and the
also
Beast.
good.
Are you
I'm
doing the new Beauty and the Beast or the
Just
original
thinking
Beauty
that.
and the Beast?
the original.
OG.
What kind of a
OG.
we could edit that
I
question
mean,
out. That's come on, that's not even a question.
we don't do edits anymore.
The original.
I mean, the new one is good too. Come on.
It is good.
Yeah, I haven't seen
Nothing,
it.
it will not beat the original though.
No,
No.
nothing ever beats the originals. Come on.
No, they did. I think that Disney with the newer movies like Encanto and stuff like that, they are really up in the game though. I
Yeah,
mean,
Disney
especially
is
soundtrack
just
wise.
right.
Disney is just a force to be reckoned with.
Yes. I like that. Talking about, we'll segue into Star Wars. Star Wars will also count now.
Oh,
That's true.
that's a
You
whole nother conversation.
Right.
that's true. You can I guess can you say a Star Wars film is your favorite Disney movie now? I mean,
It's Disney.
It technically is Disney. I have a lot of
right?
Star Wars things, so that could also work.
Wait,
Yeah.
technically, so is Marvel.
Yeah.
Ooh.
Oh,
Now
Marvel's
we're
good
digging into a
too.
part two of the episode.
This next
Right.
episode, next episode only talks about Marvel, Disney.
Right.
I love it. I love it. All right. So, Alex, how can our listeners get in touch with you? Where can they find you on social media platforms? How are they reaching you?
Any which way. So Oncopelvic PT is my handle on pretty much all the social media channels. Instagram, Facebook, Twitter, X, whatever it is now. TikTok until it's banned. Um, Threads, YouTube. I've gotten more into long form content in the last year. And then they can also email me. So especially students, like I love when students email me and reach out to me. I know it can be really intimidating as a student to reach out to a therapist, but like, please, like, I'm an open book. Please email me. My email is hello@oncopelvicpt.com.
I like that email.
Hello.
I think that's the best introduction email that you can have, right? Well, thank you so much for joining us. We really do appreciate your time with joining us on the podcast today. And we look forward to part two, talking about more about Disney, Star Wars, and Marvel. So thank you so much for joining us.
Yes, thank you so much.
Thank you for having me on. I appreciate it.
Now that you heard our interview with Dr. Alex Hill, here is a quote from Mia Hamm. Take your victories, whatever they might be, cherish them, use them, but don't settle for them. Keep on striving for those goals that you have. If you achieve one of those goals, great, congratulations. Go for the next one. Do not settle. Do not ever stop. Do not slow down. There will be haters, but keep on powering through. You can do this. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow. Thank you once again.